This is a very exciting day. But today I am announcing that SSM Health will be building a brand new hospital.
For the partnership of SSM Health and the SLUCare Physician Group, the dream began at the very beginning with a promise made on day one that this day would come.
Today we break ground on a project that is part of over $1 billion being invested right here in Midtown.
And at the heart of it will be a gleaming and graceful medical center, rising 10 floors toward the sky, being built next to the existing SSM Health St. Louis University Hospital.
Oh, happy day. Oh, happy day.
Today is indeed a happy day. It's been a long time coming for our patients, employees, and our community.
The original hospital was built in 1933 on the highest point in St. Louis, making it both a local landmark and a beacon for those in need of healing. But the advance of time and technology have hastened the need for its replacement.
Hospitals are public spaces. They are bedrocks of the community, and so they really need to be able to interact with their community in a meaningful way.
And that philosophy is reflected in every square inch of the new 800,000 square foot St. Louis University Hospital and adjoining ambulatory care center, being built on underutilized land in the heart of Midtown St. Louis.
We want to make a difference, and this is, tangible evidence that we're really committed in community, and it's a fantastic partnership. I couldn't be more excited.
The new St. Louis University Hospital will extend SSM Health's compassionate care to its neighbors, while at the same time helping to heal the city itself.
This is so terrific. I mean, a $550 million project right here in the heart of Midtown. And, SLU's investment here is just transformative, really.
SSM, as well as St. Louis, you have a long history of providing care, and not based on whether you can pay for it, but on meeting the needs of a community.
In keeping with SSM Health's core values of respect and community, staff members and even patient families played critical roles in the planning process. The hospital design team even created styrofoam mock-ups representing key areas of the new hospital for employees to explore, looking for ways to make the layout more user-friendly.
They really become laboratories for designing the individual spaces. And you want to make sure you get those right before you build them, because in the case of the beds, you're doing 300 of them. So if it's wrong one time, it's wrong 300 times over.
One of the questions that came up was literally, does the door swing into the room or does it swing out into the hall? And there was a long conversation about that, and we actually took a vote among the staff of which way should it swing.
Among the improvements being made for both aesthetic and therapeutic reasons is an emphasis on natural light throughout the building. And because this is also an academic hospital, the design team wanted to make sure it literally measures up to the unique needs of medical students.
It's super exciting to have the bigger hallways. That doesn't sound like a thing you would really get super excited about, but if you've been in a hallway of an academic hospital, they tend to get crowded.
The rooms themselves will also be bigger, allowing staff and students to consult directly with their patients as a team.
The medical press is now full of stories about interprofessional care. That is going to be the wave of the future for educating healthcare providers, and this is going to be a great venue for us to do that.
The level of detail involved in creating a modern medical center is staggering. So throughout the design process, the team relied on SSM Health's core values as their touchstone, ensuring the hospital they've created is up to date, but also down to earth.
Come on, happy day. Happy day.
September 1st, 2020, we'll be up and operating in the new hospital. We are from St. Louis, we are part of St. Louis, and we are really part of investing in our community.